and I'm with the Michigan Medicare Medicaid Assistance Program. I have been a volunteer with the program for about 15 years, and then they decided to pay me, so I'm happy, happy to be here.
That's good news.
Thanks. Just to tell you a little bit about my background, I am a native Michigander. I am an alum of the University of Michigan, go Blue. And I have worked for IBM. I worked for IBM for 30 years in technical positions as well as marketing and human resources. I retired from there and started working at Beaumont Hospital in their home health department. I retired from there and took off some time and then started volunteering as well as working for the Area Agency on Aging in the department that helps with Medicare and Medicaid assistance. So I will include some information about our program in the presentation. Okay, Marianne?
That sounds fantastic. So I think Loretta and I talked earlier, and we got some really great questions emailed in ahead of time that I forwarded to Loretta. So she'll cover those at the end of the presentation today. And then for the rest of you, as Loretta's talking, if you could kindly just put your questions in the chat area of our Zoom here. So right here, I'm going to type a question. And I encourage you to put your questions in there right when you think about them, because if you just wait till the end, you're going to forget. So go ahead and type your questions in there. And then as long as Loretta has time afterwards, we'll let each person, you know, kind of unmute themselves and ask their question. How's that sound?
Sounds good.
Okay, so you want to go ahead and share your screen?
I am going to do that.
Perfect.
And I'm going to start from the beginning. Oops. Okay, Medicare 101.
Thank you, Loretta.
You're welcome. And thanks for having me, Marianne. I appreciate that. My objective today is to introduce you to the different parts of Medicare and talk about how and when to enroll, and to give you information about the Michigan Medicare Medicaid Assistance Program and how we can help you understand Medicare and its supplementary programs. We are a part of the Area Agency on Aging, 1B, and we cover 6 counties across southeastern Michigan, all the way from St. Clair County in the east to Washtenaw County in the west, Oakland and Macomb in the north to Monroe in the south. So let me go through our agenda today. We'll talk about MAP, what is Medicare, how to enroll and when to enroll, Medicare A, B, C, and D, the benefits, the costs, what is Medigap, how it works with Medicare, prescription drug coverage, Medicare Advantage plans, if you're low income, how to get extra help and subsidies, how to avoid Medicare fraud, and then a little bit about what's new in 2021. We're just starting to get 2021 information in, and as we get it, we will be hosting webinars and Facebook Live meetings and getting that information out to you if you don't have a Medicare new book. And if you want a Medicare new book and you don't have one, you can always call our 800 number, which I'll give you at the end of the presentation. So let's talk about MAP first and then get into Medicare. I am the Oakland County Coordinator, and so I have about 70 volunteers and staff that work under me, work with me, I should say. They're certified and have been trained in healthcare benefits and counseling. This includes Medicare, Medicaid, and other insurance products. MAP counselors are not connected with any insurance company, and they're not licensed to sell insurance. In many states, MAP is called SHIP. You might hear that acronym, SHIP, which stands for the State Health Insurance Program. And there are SHIPs in every county and every state in the United States. They offer free one-on-one health benefits counseling and assistance. A MAP counselor can help you understand all the new healthcare options that you'll get with Medicare enrollment. We understand Medicare and Medicaid and the differences between them and the fact that you can use both of them at once. We can help you compare plans or enroll you in a Medicare plan, either a prescription drug plan or a Medicare Advantage plan. And we can also review supplemental insurance information with you, also called Medigap. We are allowed to enroll you in Medigap plans, but we can give you information on how to contact the various insurance companies that sell Medigap plans. A MAP counselor can also, if you're low income, help you apply for Medicaid or a Medicare savings program, and also help you identify and report scams that are out there. And we'll talk a little bit more about that as well. So let's get into the meat of the program. What is Medicare? And how do you enroll? Well, Medicare is health insurance for those who are 65 and older. Also, those who are under 65 and on Social Security disability are eligible for Medicare after 24 months. And an individual can be any age if they have end-stage renal disease. For example, if they're on dialysis or awaiting a transplant, they are eligible for Medicare. Medicare is administered by the federal government out of the Department of Health and Human Services. And the specific agency is called CMS, the Centers for Medicare and Medicaid Services. However, you enroll through Social Security for most people. If you work for the railroad, they have their own railroad retirement board, but for most people, they will be interacting with the Social Security Administration. There are multiple ways to enroll. You can enroll online at ssa.gov. You can go to your local Social Security office when they're open. They are not open now, but they are collecting mail. So if you have to mail your form in, you can mail it to your local branch. The forms can be downloaded for enrollment if you don't want to do it online at ssa.gov. Or you can give us a call at our 800 number and we can get you the forms and get any kind of assistance you might need by just calling MAP. Medicare is automatic if you're already receiving Social Security benefits. You can get Social Security at 62 if you so choose. But if you are getting those benefits, then you'll automatically receive your Medicare Part A and Part B cards without an additional application. You'll receive an initial enrollment period package. It's usually mailed 3 months before age 65 or 3 months before your 25th month of disability benefits. So if you're not receiving Social Security, then again, you can enroll once you turn 65, or if you're still working, you will get a special enrollment period to enroll. But again, you can enroll at your local Social Security office. You can enroll by calling Social Security at their 1-800 number. You may have to wait a while on the phone, before someone picks up, but they will enroll you over the phone, and you can enroll online at socialsecurity.gov or ssa.gov. If you are still working after age 65, you'll get an 8-month special enrollment period to enroll in Part A and B when you stop working and your employer coverage ends. However, you'll only get 2 months, it's actually 63 days, to enroll in Part D for drug coverage. If you have already enrolled in Part A, which is usually free if someone has worked for 10 years, then you can also enroll in Part D. You don't have to wait until you get Part B as in boy. So again, you'll have 8 months if you haven't enrolled in most people enroll at 65 for Medicare Part A because it's free, but they don't enroll in Part B because they have to pay a premium. So you will get that 8-month special enrollment period to enroll in Part B when you stop working and your employer coverage ends. Your initial enrollment period will last for 7 months. It begins three months before your 65th birthday, includes the month you turn 65, and ends 3 months after you turn 65. There are other times that you can enroll, special enrollment periods or general enrollment periods. But if you delay beyond these enrollment periods, you may pay a 10% penalty if you delay enrolling. And all our counselors are aware of these enrollment periods. Once you get your Medicare card, it's a red, white, and blue card, and it's used when the beneficiary gets health care. You take it to you in the when you're going to the doctor. The Medicare card shows your Medicare coverage, Part A, hospital coverage, and Part B, medical coverage, and the dates the coverage starts. The Medicare card also shows your claim number. It used to be the same as your Social Security number, but that was associated with a lot of fraud. So they changed it to an 11-digit random number and letters. If you happen to choose a Medicare health plan like a HMO or PPO, your plan will give you a card to use when you get healthcare services and supplies, and you don't need your Medicare Part A and B card. So you would just need the one card at a time. You can contact Social Security if any of the information on the card is incorrect, or if you lose your card, they can send you another. If you don't want Part B, as in boy, because you're still working and you don't want to pay the Medicare Part B premium, you would follow instructions on the back of the card and send the card back. There are generally 4 parts of Medicare. Part A is your hospital insurance. Part B is your medical insurance, outpatient insurance. Part C is Medicare Advantage, like an HMO or a PPO that you may be familiar with. And then Part D is for drug coverage. Part B is sometimes called the all-in-one plan because it includes Parts A, Parts B, and D. One of the questions that we get quite a bit, and you probably can't see the details on this chart, but there are 2 paths that you can take to get supplementary coverage for Medicare. You can go down the original Medicare path, or you can go down the Medicare Advantage path. If you choose the original Medicare path, you'll get Part A and Part B. You'll sign up for drug coverage, and then you can also sign up for a Medigap plan. If you sign up go down the Medicare Advantage plan path, you just sign up for Medicare Advantage, you just have the one card. It will include Part A and Part B services, as well as drug coverage and supplementary coverage. So let's talk about original Medicare first. Medicare Part A is your hospital insurance, and it includes benefits for semi-private rooms, meals, general nursing, and other hospital services, and includes inpatient psychiatric care if you're in the hospital. Skilled nursing facility is a facility where when you're released from the hospital, if you still need medical care for rehab, for example, you can go to a skilled nursing facility, and it would include payments for those facilities. There's also benefits for home health care, hospice care as well. Medicare Part B is your medical insurance or outpatient insurance, and includes benefits for doctor visits, outpatient, hospital services, lab tests, durable medical equipment such as wheelchairs, hospital beds, walkers, and oxygen, and preventive services. Some of these will be free. If it's a preventive services, some of them will have a copay associated with them. This chart includes, for the various services, what the benefit might be, as well as what you might pay. And what you might pay is generally considered a copay if you don't have supplementary coverage like a Medicare Advantage plan or a Medigap plan. But there are copays associated with Part A and Part B. Generally, for Part A, there's no premium if you have worked 10 years or more. For Part B, there is a monthly premium. Right now, it's $144.60 a month, and you would pay that amount. Either it will come out of your Social Security check if you're getting Social Security, or Medicare can bill you and you can pay separately. But these are the services that you can expect for Medicare Part B. Generally, you'll either pay nothing for preventative services or 20% of the Medicare approved amount after you pay the $198 annual deductible. And I'm going to get a updated presentation to Mary Ann so that she can send this presentation to you. I don't want to ruin your eyes. I want to talk about IRMA for a minute. This is the income-related monthly adjusted amount surcharge for those high-income individuals who have income that is greater than $87,000 per year. You will be charged more than the $144.60 for Medicare Part B. And you will also have to pay a surcharge in addition to whatever premium you might pay for your drug coverage. It's divided into different brackets based on your modified adjusted gross income from 2 years prior. So they'll be looking, in 2021, they'll be looking at your tax returns from 2019. The chart shows the brackets for both individual and joint filers for 2020. I have not seen the chart for 2021, but I expect that I will see that sometime in December. And Medicare, I should say, Social Security will send you a letter if you are subject to IRMA charges. So how do you pay your bill? And how do you pay IRMA if you have no Social Security benefits yet? Well, Medicare can bill you quarterly. There is a form that has to be filled out. That's, if you want to Google that form, you can see what it looks like. You can pay by check, by credit or debit card. They take Visa, MasterCard, Amex, and Discover cards. You can have your payments deducted from your bank account. You can use your bank's online bill payment services, and you can continue to pay using these means even after you receive Social Security. If you don't tell Social Security how to bill you, they will take the money from your Social Security benefit check. So I wanted to mention the Welcome to Medicare visit. When you first get Medicare, you can call your doctor and tell them that you want a Welcome to Medicare visit. This is a one-time visit. It is free, and it's usually within the first 12 months of getting Medicare Part B. It's usually a consultation where your doctor will review your medical and social history, your height, your weight, your BMI, blood pressure, give you a simple vision test. They'll look for risk factors for depression, and they'll kind of test your functional abilities and level of safety, which means an assessment of hearing impairment, your ability to successfully perform activities of daily living, whether you're fall risk or not, and home safety items. They will give you advice to help you prevent disease, improve your health, and stay well. They can also give you a brief written plan, like a checklist, letting you know if any additional screenings or preventative services are needed. At this visit, the doctor can also refer you for additional Medicare screenings if the referral is a result of the initial Welcome to Medicare visit. Again, generally no cost, and it can be a great benefit that people should take advantage of. If you don't make the Welcome to Medicare visit, Medicare covers a yearly wellness visit. After you've had Medicare Part B for longer than 12 months, you can get this annual visit to develop or update a prevention plan just for you. And this is available to you, one annual wellness visit every 12 months. Again, they'll cover all the things that they covered in your Welcome to Medicare visit. And you don't need to get the Medicare to Welcome visit before you get the annual wellness visit. If you choose to get the Welcome to Medicare visit, you'll have to wait 12 months before you can get your yearly annual wellness visit. These are just some of the preventive and wellness services that can be covered during these yearly visits. This slide details just a few of them. Many other services are covered, such as BMI, body mass measurements, glaucoma tests, diabetes, self-management training, obesity screening, and counseling. There may not be a cost for the test, but there may be costs for doctor services or a facility fee, depending on where you get these tests done. This lists some of the Medicare recommended adult vaccines. Vaccines can be covered under Medicare Part B or Part C or Part D. Medicare Part B or the Medicare Advantage Plan generally covers the flu shot, pneumonia, and the hepatitis B vaccines for free. Some of the others are associated with a copay. but you should take advantage, particularly this year, of the flu vaccine. Okay. We're now going to discuss Medigap, which also goes with Original Medicare. These are policies, also called Medicare Supplement. If you hear the name, it means the same as Medigap. They're private insurance that covers the policyholder only. They're sold by insurance companies to supplement Original Medicare and pay for the gaps in Original Medicare, like deductibles, co-insurance, and co-pays. They pay for Medicare covered services provided by any doctor, hospital, or provider that accepts Medicare, and it can be anywhere in the United States. Medigap may cover certain things that Medicare doesn't, depending on the Medigap plan, but they generally follow the Medicare rules. I could do an entire presentation on Medigap, but I won't. But if you are interested in Medigap counseling, please give our counselors a call and they can certainly help you. The basic benefits are covered by all Medigap plans. I know this is difficult to read. This includes the following: Medicare Part A, co-insurance and hospital costs. It also covers an additional 365 days after your Medicare benefits are used up. It covers can cover Medicare Part B co-insurance and co-pays depending on the plan. It can also cover the first 3 pints of blood if you need an infusion, and Part A hospice care. Each Medicare plans covers different additional benefits. Just so you'll know, Medicare Plan C and Medicare Plan F are no longer sold to beneficiaries who are new to Medicare unless they turn 65 prior to 2020. And this was enacted by Congress, and it is the law of the land. But if you cannot get a Plan C or an F, you can get a Medigap Plan D or Plan G, which cover the same benefits except for the Medicare Part B deductible. What is Part D? That's for drug coverage. It works with Original Medicare and Medigap. Technically, Part D is optional, but there are penalties for not getting it when you sign up for Original Medicare or when you sign up for Medicare Part B. It's provided by private insurance companies, and it can be one of the most complicated parts of enrolling in Medicare. It involves researching plans, comparing prices, comparing formularies, which are the list of covered drugs, and it can just be very complicated. Our counselors are trained to assist beneficiaries and to take the stress out of enrolling. Individuals with low income and assets may be able to get extra help to help pay for the Medicare drug plan. To get Medicare Part D, you must have Medicare Part A and or Medicare Part B. You can get a Part D drug plan if you only have Medicare Part A. You have to live in the plan service area, which is generally the state that you live in. You can't live outside the US. You can't be incarcerated, and you must enroll in a plan with a private insurance company. In most cases, there's no automatic enrollment. and you must fill out an application. You can also call the plan to get enrolled. You can enroll through Medicare.gov online, or you can call 1-800-MEDICARE and they can enroll you. I think I probably have covered that, but it's available for people who have original Medicare Parts A and B. You generally don't get a standalone plan if you have Medicare Part C because the drug coverage is included in Part C. So it can be a standalone plan, it can be included in a Medicare Advantage plan, and all plans have to include a range of drugs in each drug category. I'm just a little. Okay, I am, just give me a minute here. How do you join a Medicare Part D plan? Well, you would join it, if you so choose, during your 7-month initial enrollment period, which is 3 months before your 65th birthday, usually, the month of your birthday, and then continues 3 months after. There is an annual fall enrollment period, which will start shortly, where you can join a Medicare Part D plan, or you can change your plan, or you can disenroll from your plan. But if you join or change a plan between October 15th and December 7th, your coverage would not start for that new plan until January 1st. There are also special enrollment periods that you may be eligible for if you are low income, if you've lost your job, or you've moved outside of the plan service area. So you can contact the plan to join, call they usually have an 800 number, visit their website. Again, you can join by going on Medicare.gov or by calling our 800 number. Okay. So now we're going to talk about the other path, Medicare Advantage plans. This is also called Part C, and it's health plan options that are approved by Medicare, but they're run by private companies. And they're generally either an HMO or a PPO. Medicare actually pays the insurance companies a set amount for each member's care, and it's just another way to get your Medicare benefits. It is considered part of Medicare. But they do have networks. You may have to use their network doctors, especially if you have an HMO. If you have a PPO, you can use the network doctors, or you can go outside of the network. But you'll generally pay more if you go outside of the network for your doctor or your hospital. Medicare Advantage plans are still Medicare. You have all the rights and protections of Medicare, even though it's run by private companies. You still get your Part A and your Part B services. You may get additional benefits that are offered through the plan, like vision or dental or fitness, like silver sneakers, or sometimes they even include transportation benefits, as well as health and wellness programs. The benefits and cost sharing may be different than in original Medicare, but in all plans, you usually will pay a deductible, co-pays, and co-insurance that vary by plan. When can you enroll in a Medicare Advantage plan? Again, the same time that you enroll in Medicare, or you can join during the fall open enrollment period. Your coverage would start in January. You can also change your plan during open enrollment in the fall. Just this year, they initiated a open enrollment period in the wintertime for just for Medicare Advantage plans. And this is from January 1st through March 31st. You can only change plans, or you can go back to original Medicare and enroll in a Part D plan for your drug coverage. You cannot enroll for the first time during this January to March period. You can enroll for the first time during fall open enrollment. So what help is there if you have low income and limited resources? There are programs available to help with your Medicare costs. These include Extra Help, Medicaid, and the Medicare Savings Program, which will help pay for your Medicare premiums, and some can even help with your copays and deductibles. There is a Michigan Medigap subsidy program that is available for those who are in the lower income brackets if you choose certain Medigap plans, and those include the plans from Blue Cross, United Healthcare, McLaren, as well as, I believe the last one is Priority. You can get a subsidy of from $25 to over $100, depending on your income and your assets. No, they don't look at your assets, excuse me, just your income. So you would have to contact the Michigan Medigap subsidy program, and if you were interested in that subsidy and if you qualified for that subsidy. And again, if you want more information on that, you can call one of our counselors and we can help with that. Medicare fraud is one of the most common schemes affecting seniors these days. MAP can assist beneficiaries if they feel that they've been victims of fraud or abuse. Recent scams have been related to COVID-19, where individuals will be contacted either through email or a phone call, where someone is offering a free test, a medication, a vaccine that is not approved by the CDC or anybody else. It's not medically necessary. And this could end up costing you a lot of money if you give them your Medicare number, they submit a bill and Medicare rejects it. So please do not give out your Medicare or your Medicaid number to any individual unless you have requested assistance from them. We've also seen cases where individuals have been misled into joining a new Medicare plan, thinking that they were just asking for more information, and the agent took that as a, yes, of course you want to buy my Medicare plan, and enrolled the individual. And we were able to help get that individual back to their original plan, so we can certainly help you do that as well. I just wanted to say a few words about what's new in 2021. Let me just find my information about that. There are three things that stood out for us related to what's new in 2021. And one of the most expensive drugs that an individual can pay for is insulin if you're a diabetic. And what's happened is a new senior savings model has been implemented that can save you hundreds, even thousands of dollars each year in out-of-pocket costs for insulin. So plans had to sign up for the senior savings model. These are Medicare Advantage plans that I'm talking about, as well as drug plans. And those plans that signed up to participate will offer coverage choices that will include multiple types of insulin at a maximum copay of $35 for a 30-day supply. And I've seen where individuals have been paying $200, $300, $400, depending on the type of insulin they use for a 30-day supply. So that's huge for, especially for diabetics. Also, in the past, those who had kidney disease and were subject to end-stage renal disease were unable to join a Medicare Advantage plan. But they can now sign up for a plan during open enrollment, and it would start January 1st, 2021. We always are getting calls from individuals who are looking for help paying for dialysis copays. So this will be a big help. And then for those of us who, like me and Mary Ann, who suffer from lower back pain, Medicare now covers up to 12 acupuncture visits within 90 days, but only for chronic lower back pain. And I expect to see that expanded in the future. But right now, it's limited. I also wanted to bring your attention to our open enrollment virtual assistance days. We are counseling between October 15th and December 7th. And the 70 counselors from Oakland County, as well as all of our counselors, which I think we have over 140 now, we are either counseling by phone or through Zoom, but you do have to make an appointment. We have appointments that start at 9, they're 90 minutes long. They start at 9:30, 11 o'clock, no, 9:30 to 11, 11 to 12:30. Then we take a break, start again at 1, and go to 2:30, and then our last appointment is at 2:30. Although we do have a few individuals who counsel in the evening starting at 6 p.m. But if you would like some assistance in either signing up for Medicare, looking at your current plan and seeing what's changed, determining if you want to switch plans or switch from a Part D plan to Medicare Advantage plan or vice versa, please give us a call at 1-800-803-7174. We're also on social media. So we do have, the Area Agency on Aging has a Facebook page, and we are going to be doing a Facebook Live seminar on what's new in Medicare for 2021. It's going to be Wednesday, October 14th, between 12 and 1. And the topics will include Medicare basics, open enrollment, as well as what's changed in Medicare for 2021. You can register by going to this website. Again, I'm going to send Mary Ann the presentations that she can get to you, or you can call 248-320-1144. So that's all I had today. I am open for questions, but I just wanted to hawk our service again. If you want to speak with a counselor about your specific situation, give us a call. It's confidential. We're unbiased. We counsel over the phone or via Zoom or your GoToMeeting or Blue Jeans or whatever you have, we can use. And no question is too trivial. We often deal with very complicated situations as well. You can get more information And I highly recommend Medicare.gov. There is a Medicare and You handbook for 2020 as well as 2021. If you don't have a handbook, we can mail one to you if you call our 800 number, 800-803-7174. And you also can call 1-800-MEDICARE. Although we get a lot of referrals from 1-800-MEDICARE if you have a particularly complicated situation.